You know, we've talked a lot on this show about various dire threats to our civil liberties, to our ability to use the internet, to our ability to access a free press, express our opinions, poverty, our ability to escape poverty, to protect the middle class. Let's talk about one other threat, just so you go out of here feeling psyched, okay? And that one other threat is this, that, you know, the right likes to scare us with the notion that single-payer health care is somehow draconian or invasive, as if allowing the people through their elected representatives to make decisions about how we protect health care as a basic human right is somehow invasive. That's the right-wing myth. They never tell you how horrible it would be to live under corporate single payer. And yet large portions of this country, geographically speaking, already do live under corporatized, profit-driven, single-payer, whose sole goal, institutions, organizations, corporations, whose sole goal is to maximize profit regardless of the impact on your health, life, or death, except to the extent that it brings them the approbation of the public, or perhaps some new regulations or laws they would like to avoid. Now, if you live in certain cities in this country, you have the choice of one or at most two such corporations. They offer essentially the same product. They offer the same kind of utilization review barriers to getting the service you need. They are not your friend. Now, that's not good news. How could it get worse? Well, I'm glad you asked that question, because now we have a glimpse into how it could get worse, and very probably will very shortly, given the yahoos we have running our government right now. CVS, the pharmacy chain, is planning to buy Aetna, the insurance company, for $69 billion. The New York Times calls it a deal that may reshape the health industry. I call it the deal that may reshape you, and not for the better. So $69 billion, first of all, think about that for a second. There is $69 billion floating around in our healthcare economy that has nothing to do with getting people better. And this is just one deal. There are going to be a lot of these to come. There is a lot of profit, a lot of fat built into our healthcare system. Think about it. The next time a senator says, as Orrin Hatch did recently, that we don't have the money for the Children's Health Insurance Program. Really? Well, I just saw $69 billion go from one bunch of executives to another. So I think you could take that $69 billion and give a lot of kids health care with that money. Okay, now let's talk about what they're planning to do. Again, working off the Times report, the Times says this: a combined CVS-Aetna could position itself as a formidable figure in the changing landscape of healthcare. Now, the idea, on Sunday, the two companies emphasized their ability to transform CVS's 10,000 pharmacy and clinic locations into community-based sites of care that would be far less expensive for patients. We think of it as creating a new front door to healthcare for America, said CVS Health's chief executive, because of course they're just folks. Come on in, it's the front door's open. Of course, what they would be doing, if you read between the lines in this report and their own statements and others, he says it's in their community, it's in their home. CVS has the draw. People trust the pharmacist. In other words, they're going to take a lot of medical care and shift it out to pharmacists who aren't licensed, trained to do physician care. They're going to take a lot of medical care, as they do in their clinics, and ship it out to physician extenders, as they're called, paraprofessionals, they're called in some cases. Look, they're great people, some of them. Nurse practitioners, terrific. There is a role for nurses, nurse practitioners, physician assistants, pharmacists. They're all great professionals. They do have a role in the healthcare system, but I don't want that role to be defined by a corporation, and neither should you, because they're going to use that role not to get you better care and more care, which is what the term physician extender implies, but instead to be physician retractors, if you will, people who will deny care to you and me. When you need to see a doctor, you need to see a doctor. So we don't want to set obstacles to that process. Now, these fine professionals have a great role to play in giving you care that you don't need a doctor for, but there are many occasions when that comes up. I rely on pharmacists to give me advice when I need it. If I'm prescribed a medication, I look to those professionals to help me. I also do get some care from physician assistants, from nurse practitioners. They're great. But this is about, behind the folksy, it's in their home, it's the front door. What these guys are really trying to do is vertically integrate the entire healthcare system so that they control when you get to see a doctor, when you get a prescription. Maybe they get a kickback on some of those transactions. Those doctors, those nurse practitioners, those pharmacists are going to be measured and tracked and perhaps even incentivized based on how cost efficient they are. That is a kind of vertically integrated single payer system where everybody is on the same computer system and this under the same management, looking to do one thing and one thing only, and that is to maximize profits. I do not want the physician who decides whether I need additional care or not to be working for a company that maximizes profits. I do not want the nurse practitioner who's looking me over and giving me advice to be under the direction and employ of a corporation looking to maximize profits. I do not want the pharmacist who tells me whether or not I should ask for a generic substitution to be part of that corporation either. This should be and they keep saying, well, we'll achieve savings on the front end. Well, you know what? I don't believe it, number one. And number two, I think any kind of savings that's based on denying us the care we need is a phony savings that we will pay for with our health, our wealth, and in the long run, our lives. I do not believe this is the wave of the future. More corporate submission or us rather, submitting to corporations in the healthcare process. I think we should demand our healthcare freedom. I think we should demand single payer run by the people and not the corporations.